No community should feel like there's an inequality. Actively working with them feels like their needs are being catered for. The UK as a whole and Manchester as a whole is so diverse that you're never going to be able to plug all the gaps. But as long as you're outwardly making an effort to cater for, as many needs as you can, you'll always have the community on your side.
So I think the way that public involvement and engagement can help pave the way is because it's going to help us understand the barriers and enablers, all the snakes and ladders, as I like to call it. What are the things that are stopping, getting in the way of people accessing early detection or screening that's made available? And what are the enablers? What are the ladders? What can we put in place to make it easier for people in communities to take up these services when they're offered?
So this work is really, really important for the program. It's looking at how we can build a blueprint to engaging with communities at every disease area. It's allowing us to reshape an approach for the future. So this program is allowing us to identify those challenges and plan better services for advanced diagnostics or diagnostics more generally speaking, with the aim that people take up prevention and early identification of diseases, irrespective of which culture they are coming from.
Trust will always be the umbrella that everything goes under. And once you have that trust, people are liable to be more open with yourselves, open with health innovation, open with the health service, open with whatever the situation is at the time. And that's the key thing. How do you build that trust? How do we go about getting it so that people do feel comfortable and do feel that they can engage with us?
DEVOTE's working with patients and members of the public in the early detection of liver disease project as part of the broader Accelerator programme.
So we kind of have this whole toolkit of expertise of doing research with these types of audiences that we can bring to the table, and it kind of really strengthens the work that the Health Innovation Accelerator team can already do.
So utilising the data that Mindfield and other partners within the projects have been working on, this allows us to really drill down into what the audiences are most likely to engage with. So as part of the co-creation process, we've been able to identify what sort of platforms are utilised by the patients, what sort of creative routes are most likely to engage, and what sort of messaging really strikes them into taking meaningful actions for diagnostic services in the Greater Manchester area.
I think when breaking down the barriers, there has to be different ways of engagement, because one size fits all just won't work. And it's great to see Health Innovation Manchester reaching out to community organisations like LGBT Foundation, who are placed really within those communities to be able to have those conversations.
The issue is go and be part of it, and it speaks to you. It identifies with you. The innovation, the research will be identifying with you as an individual or people like you. So it is important for us to participate.
Being innovative is how we are going to carry the message, but also look at the messenger. It's as good as the message. If you came with a message with people who actually know, and that's the only way where people can know, our voices can be heard.